1982, I gave birth to a premature baby, Madeline, who was 2 pounds 6 ounces. I was surprised because, I started having pain and didn't know what it was from. So when I went into the hospital, and they said, "We, think you're going to give birth to a very small baby, and the odds are maybe 10% that she'll survive because it was 32 years ago." She was intubated for about 115 days. The nurses and the doctors at the hospital taught me what I needed to know to take my baby home. She survived. I was a lucky one. When she was about 6 years old, I decided to go back to school. And in 1991, I became a nurse. I really wanted to give back to other mothers what I was given so graciously at the hospital and so lovingly. I don't think Madeline would be where she was today if it wasn't for the nurses that took care of her. So currently I'm the nurse manager of the NICU, a Neonatal Intensive Care Unit for the North Shore LIJ Health System. We take care of all different types of infants, ranging from premature infants to very sick full-term babies. Premature babies are fragile because their skin is very underdeveloped and they're very small. And we use techniques like developmental care to kind of mimic what the womb was like. Sometimes the babies are so sick that they are not held for maybe sometimes a week, sometimes it's maybe 4 weeks, even longer. And when the baby does start to make a turn for the better and we're able to take away some of the technology, there's no greater satisfaction than handing that mother her own baby for the first time. And to watch the smile on her face and the tears of joy is indescribable. I think one of the most difficult roles of a staff nurse, especially, is being at the bedside for 12 hours a day with one patient or 2 patients. And sometimes the baby's outcome might not be what we would anticipate, or the baby's taking a turn for the worse. And so that nurse is there giving support to these parents. And oftentimes, no matter what the therapy is or the technology that we have, it's not enough to sustain their life. Oftentimes parents have to make difficult decisions to withdraw care from their baby or watch as their baby ends their life. It breaks your heart that the parents are going through such a terrible ordeal for them because they expect to take a baby home and sometimes they don't.
I gave birth on June 6th. I was 28 weeks exactly. As soon as we arrived, they brought me into triage, and within 12 minutes, there was a room full of doctors. I was being rushed into the OR because the baby was breech and I was at 5 centimeters. At 8:21, she was born. I don't think she would have survived it if it wasn't for the nurses. Tomorrow she'll be 2 months exactly. It is scary, just the thought that you would bring a child into the world at 28 weeks. It's never what you imagine when you imagine yourself having a baby. She's doing great. She still has a little bit of feeding issues, but if we can get that under control, I can get her home.
So the day begins with the brief in the morning where we meet with the entire staff who are facing the day together, and we get a snapshot of what the day is like, what babies could be born today, what babies are going home today, what babies are sick. And then we leave from there and go on, and the nurses take their assignments, and I kind of like walk around and make sure everybody's okay. I'll notice maybe baby needs a little extra blanket or needs a pacifier because he's crying or she's crying. But the nurses really spend the most time with the parents at the bedside. I'm there to help them. I look at my role as more as a mentor. The role of a nurse manager is busy, and sometimes you don't get the opportunity to go in as much as you like to. I always tell them my job is to relieve your frustration. So if you need me to go somewhere for you or go downstairs and get something for you or whatever it is you need, I'm there for you. I have a great staff. I have a staff of about 160. I have 6 assistant nurse managers that help me. I couldn't do my job without them. And they're like my right-hand girls. And we go to a bed report in the morning where we also talk about what our NICU is happening for the day. Some of the day is spent in meetings. Some days a lot of meetings. Some days not so much. But we want to make sure that the unit's running smooth, so what supplies they need. Any parents have any questions or any issues, I try to be there for them. But it's a team effort, so it's not only just me. I really couldn't do what I do without everybody else.
The nurses are phenomenal. They know exactly how to keep you calm, how to deal with every situation based on what is going on with your child. They have to have a great leader to be great. She makes sure that you're doing well and you're getting great care, and anytime you need her. She's kind of like a very nurturing mother. Sometimes you need a mom.
It doesn't take a lot of money, it doesn't take a lot of energy, it takes love, and I love what I do. It gives me great satisfaction. I always look forward to walking into work in the morning, no matter what I know I might face, because I know what the day might bring. But if we can make their journey a little bit easier every day, then that's what we're there for. I'm happy to say that I'm still in love with my husband, and we have 3 beautiful daughters, 2 of which are nurses now, and one works for the health system also as a unit receptionist, and 2 of those daughters have children. And now Madeline has a brand new addition to the family, Jackson, who's only 2 months old. They're the light of my life, those children. Church is very important to us, to all of us, my whole family. I found a peace from church, and I never stopped really going. When I was about 17 years old, I started a folk group at church that grew to like 25 kids. It was something we did for a very long time. I did it until I actually became a nurse. I actually look at my job as like a ministry, because I feel that we're serving these people and we're helping them get to a point where they can take their babies home. When they're leaving for that final day and you're waving goodbye to them, there's nothing greater than that feeling.